Hi, I'm Katie Johnson. Back when I was in high school, I was a cheerleader and just going through practices, and I was a back spot, and I had been hit a few times, and I have the little bump on my nose, and it's always bothered me. I hate seeing the side view of my profile, so when Dr. Gross showed me what he could actually do, it almost brought a tear to my eye because I was so happy.
Okay, what we have projected on the computer imager is your before image on the profile view, and then we can start to draw on this and do some measuring. All right, so we measured your nose from the nasal bridge to the nasal tip, and we found that the measurement was 46 millimeters. So we know that the nose is excessively long in this direction here. We also measured you from this area, called the nasal ala, to the nasal tip, and found you had approximately 36 millimeters here. So we know that the tip projection is long, the length of the nose is long, and then of course we can see here the bump on the profile view. When I click on the morphing tool, you can see the after result. So I've shortened the bridge of your nose this way. I've actually rotated and brought your tip back in closer to your face and brought up the nasolabial angle 3 to 4 degrees, so it's more balanced. Now we're going to look at your frontal view, is your before. So when I click on this, you can see some of the curvature of your nose right at the bridge. As I point this out right through here, there's kind of a lazy S occurring right here, and there is definitely curvature. So most likely you fractured your nose in the past from the cheerleading injury, and it caused some curvature of the bridge of your nose. And now after the surgery, you can see how it's straighter. It doesn't have that hourglass, that widened hourglass appearance. Good morning, Katie.
How are you?
How are you feeling today?
Good.
A little bit nervous,
Yeah.
but very excited, right? Turn to your left slowly, good. Okay, you can open your eyes now. So this is our review. These are the pictures that we looked at before. So what I've drawn in here is the reduction line that we're going to perform in surgery. We're going to remove the bump here. We're actually going to shorten the tip here,
Okay.
this direction, and we'll take the bump down here.
All right.
And Becky, if you'll hand me the other photograph. Okay. And in this photograph, remember we talked about the area right here where there's a little curvature? Here. This is where we're going to straighten out the nasal bones
Okay.
into more of a vertical orientation. And then we'll also reduce the bump that's right in here. All right, so what we'll do today is we're going to soften up the tape and the casting.
Okay.
I'll remove the casting. I'll remove the sutures underneath your nose. Then we'll clean up your nose and we'll hand you the mirror so you can see how great everything looks.
All right.
Okay, here's the big moment.
Big stare. Oh my God. So different.
I'm just going to have you look straight ahead of the TV set, and I'm going to look at your profile now. Good. And there's just a little bit of swelling from the casting right here.
Yeah.
But it looks just beautiful. The tip is rotated nicely. Look in the mirror. Go ahead and look in that mirror, yep. The tip is really nicely rotated. You have a lot of swelling at the top of your nose, which is normal. And the swelling that's down here at the tip will continue to get better.
Right.
But this is a fantastic change from this view.
When he first took off the cast on the nose, I mean, it was a drastic change. It just looks real natural, and it doesn't look like a nose job you would think it would look like. I know my mom and my family, they supported me in the beginning just because they knew it really bothered me, but now they see the difference of how confident I am now. I like taking pictures. They love the result of how I feel. I truly recommend Dr. Gross. It won't be anything that is drastic and typical of a plastic surgery procedure. You'll just be happy with the results. I know I was. I know many people who have been. He's not going to sell you the product. He's really going to help you through it and make you feel great and look great.